Cutright from Healthier Pets Naturally. Welcome everyone to the meeting, and we've got the recording going, which is awesome. So I'd like to introduce Dr. Cutright as my friend and colleague. She has taught me so much about drainage. And we're going to learn a lot about what that means tonight. But if we've got animals, your pets that are stuck and are having some issues, not really progressing in their health and in their issues, symptoms, a lot of times it's an issue of drainage. And I think as we start into this next season with all the allergies and stuff, this becomes a bigger deal. Liz, you and I have been friends for a little while, and yep, I have learned a lot from you. I don't know what to say other than Dr. Liz is an amazing person. We work together well, and I'd like to just introduce her tonight as our speaker, and I'm going to give it away to you, Liz.
All right, thank you. Thank you, Dr. Sue. Well, I just want to thank everyone for joining us tonight because to me, this is a super important topic. It was kind of a game changer when it came to helping my patients out. It's something that Dr. Sue and I were both trained in, learning nutrition response testing. But when we started getting more and more tools specific to drainage, we just saw more and more success. And as for those of you who popped in earlier, we talked about how sometimes when we share cases with other competent colleagues, both Western, Eastern, integrative, sometimes the only thing I do different is add drainage support or investigate the case a little bit to figure out what is blocking that drainage. So without further ado, let's get started. So as it's titled, Healthy Drainage Means a Healthy Animal. So tonight we're going to talk about what is drainage, how does lack of drainage affect the body and cause dis-ease, and what are solutions to improve drainage in our pets' bodies and our own. So first off, everyone knows I like to clarify the words I'm using. When people think of drainage, they usually think of the big plastic tube that comes out of a wound. And that's not what we're talking about. That is drainage, it's synthetic drainage, and it's optimizing the movement of flow to heal a wound, but we won't be talking about that. You're closer to the definition of lymphatic drainage, but that's only one part of a multi-part system. So what I really like to get into is just thinking about the bigger picture. Drainage, or a better way to say it, are drainage pathways, all the structures of the body that support elimination of body waste and toxins. I'm going to ask real quick, can everyone mute themselves? I'm hearing a lot of background noise. I don't know how to do that.
I just asked in the chat that we can hear pots and pans. So whoever's potting and panning, you can just shut your mic off. That'd be great. Thank you.
Thanks, guys. So what I want to specifically get into is our drainage and or drainage pathways. It actually is all the structures of body that supports elimination of body waste and toxins. So if we look at it from a general perspective, such as an ecosystem like this mountainscape you see on the right side, it's thriving, it's green, there's movement, there's life, that's healthy drainage. When you go to the far left, you see the exact opposite. You see stagnation, you see overwhelming of waste, you don't see movement, and therefore you have imbalance and disease. So we're going to get into all the structures and components that get into that. This is a great diagram by Cellcore that shows all those components. Did you know that there's actually 8 parts? If you didn't look at it, you covered your eyes and try to guess at those parts, you'd be surprised all the different components and how they all come together. And what I find even more interesting is that you can describe not only the main parts of drainage, but what I call the 3 overflow emergency valves, which we'll get into later, which is the skin, the kidneys, and the lungs. And that's where we see a lot of diseases that the medical model tends to just manage. But when you get into connecting where these organ systems connect to and what could be the obstruction of overflow or the obstruction of flow or what could be causing an overwhelm in the system, you can often relieve those diseases. So depending on the source, waste and toxins end up in not only just from the cells and organs into lymphatics, but they should go into the liver, bile, and then the colon. But like I was saying, you might get the overflow. But essentially what I really like about this diagram is it shows how it all funnels down into the colon. And that's kind of your bottleneck. So you could be on a perfect supplement program with your dog or your cat. You could exercise, you could do all these things that are healthy living. But if you've got an overwhelm of toxin or some other obstruction or stressor that you're not catching that's affecting the colon, it's all going to back up and you're going to see imbalances. So let's just get started. So part one, let's start at the bottom of the funnel, the colon. The colon is not just a long tube. We don't actually pay enough attention to the colon and the stool itself. In fact, we're just starting to pay attention to it. A lot of you, if you listen to our past lectures, Dr. Sue was talking about the microbiome, supporting that with healthy probiotics and when it's appropriate, and or other modalities. I'll try not to get off sidetrack. I promise you guys I won't get down too many wormholes. But point is, we're learning a lot about the colon and all the importance that it has in the system. And when those processes of the colon are imbalanced, you're going to see inflammation, you're going to see constipation, you're going to see diarrhea, chronic parasites, and all of those things affect that outflow. Everybody knows the colon is that tube that takes all the particulate debris of the digested foods as it comes down, and then you have the unwanted leftover bits that are left. But we forget about the food preservatives that came in with the food dyes, the excessive amount of one nutrient or inappropriate nutrients, and then also the things that are dumped in from the bile ducts in the liver into the colon. So all of those play a part. The second part of the system, which I think this gets a lot of press already, liver and the gallbladder. We see a lot from our colleagues about, oh, I saw the liver enzymes are elevated, so I'm going to give X, Y, and Z. But we need to step back and say, well, why are these changes happening? Let's think about what these organs do. So the liver does not only clear toxins, but people think about external toxins, but they forget that the body makes metabolic waste products, its own products, uric acid, things like that. And it differentiates it into different types and gets filtered in different ways. So, that the liver filter is primarily released in fat soluble or water soluble. Fat soluble gets dumped into the bile, and that gets dumped into the intestinal tract. Water soluble goes through the urine, go through the circulation into the urine. And then lastly, don't forget about the other external things that the liver and the bile affect the intestinal tract as well. The bile directly affects the peristalsis of the colon. So if you don't have a proper functioning gallbladder and bile system, you could have constipation from that. So again, we need to not just focus on one aspect of these organs, but how they fit in together above and below the systems that they're integrated with. So getting back to what we may see symptoms of disease in these areas are elevated liver enzymes, elevated cholesterol, vomiting, loose or hard stools, and all of these can trigger those overflow valves I was just talking about: the skin, the lungs, and the kidneys. So we'll go ahead and step to the side of that funnel picture and talk about some of these overflow areas. And this is where where drainage really shines, because oftentimes people focus on this symptomatology, the disease in these organs, and say, oh, my dog has a bladder problem, my dog has asthma, my dog has chronic skin. So they give a bladder supplement, they give a lung supplement, say an anti-inflammatory, or they give omega-3s for the skin. Well, sometimes just giving nutrients to the organ isn't enough. You have to ask, why is there inflammation in the bladder? Why is it having a hard time maintaining homeostasis? Why is the pH different? The urinary system is the primary system responsible for excretion of metabolic waste. Again, there's that word. Again, uric acid from protein breakdown and other byproducts. So you have to ask, what's the diet of the dog or the cat? Are they having problems breaking down protein? Is that why the pH is off in the urine? Do we need to look at protein metabolism, go upstream? Or do we have a congestion in the liver which is responsible for that. And then we're having it backflow to the bladder, which can lead to inflammation, which can allow organisms to take effect. So that's where you can have secondary problems. We'll talk about that in the next slide. I'm getting a little ahead. But you can see how it's not just about that organ. Same thing with the lungs. Believe it or not, the lungs are also part of this whole elimination of wastes. Carbon dioxide is a waste. We cannot have too much of it for all the obvious reasons. The lungs also eliminate other wastes, not just carbon dioxide. Again, depending on the pH of your body and how noxious gases are released, you will have changes in the different gases that are released from your lungs. And that could lead to changes if you're imbalanced in that system. Asthma is one of the bigger ones we see. Then lastly, the skin. This is the biggest one we see probably of these over all these three categories of the drainage pathways that I call the emergency relief valves. The skin can just be that backup route. And when things can't get out through the normal pathways, they're going to take the next pathway they're closest to, especially if the lymphatics are backed up. So to jump to the diseases, I thought it was appropriate to choose a rat for this picture for this slide, because they can be quite deleterious, even though it can be just a simple issue of a backup in an area. But when you have backups that lead to the skin needing to drain and release toxins or metabolic waste, or the bladder, you end up with yeast infections, you end up with bacterial infections, especially in the ear. You can have heavy metals, general pollutants, food preservatives. I've seen all of those things resolve ear infections when we've handled those things. Bladder infections. I had a cat who all I had to do was offer him filtered water. He kept getting bladder infections and inappropriate urination. And the only thing we did was switch him to filtered water and provide him a supplement that helped bind the chlorine and some vitamin C to help with the bioflavonoids and reduce the inflammation in the bladder. This is actually one of my favorite cases. A little sidestep. I had a husband involved in this case who did not believe in what we were doing, proceeded to wash the cat randomly in chlorinated water, and it just took one bathing, because the skin is a large surface area for that cat to absorb chlorine, and he urinated in the house for 3 days in a row. And after that, we had to up his binders, and the husband became a believer. But it can be as simple as one extra toxin affecting one system. And then lastly, asthma is another one we see more so in cats than dogs. But you can have a combination of stressors, a food stressor leading to inflammation in certain areas. And then you just get one more stressor like molds, and boom, you have asthma. So people complain, oh, I have seasonal asthma when the mold's out. But really, they have an underlying blockage in their drainage pathways below that. And then the seasonal allergies and stimulants just come and push them over the edge. So if you can make a happier bowel, a happier colon, guess what? When the mold comes along, you won't have that much irritation. Your asthma won't be so pronounced or even present at all. And we've had cases like that as well. So, and I do want to get to, I do want to get to specifically just mention why dog skin. I feel like dog skin, we see a lot more superficial lesions, dermatitis, infections, staph pyodermas related to allergies than we do in people. And this slide is a nice little representation about how the epidermis of the dog is much thinner than that of a person, combined with their glands are completely different. We have sweat glands that mainly we're able to perspire and release toxins through all of the skin, whereas dogs, it seems to be concentrated in just the paws through a different gland called the eccrine glands. And so they can really only sweat through their paws. So if they're going to have toxins trapped in their skin, it's going to be a lot harder to release. So I think that's one of the reasons that we see a lot more skin disease than we do comparatively to people, although people are having more and more skin disease. But just to explain the differences between the types of changes in glands in dog skin, so you understand a little bit better why do we have so many dogs that are specifically focusing on licking their paws all the time? Well, most likely they're trying to release the overflow of toxins through their paws. because that's where they can, because that's where the glands are, their overflow glands, to release them. I also feel that the circulation, it's that as you extend down the arm and go down to the toes and back up, it's also the capillaries get smaller and smaller, and it's easier for things to get trapped. Long story short, I just wanted to pull this aside so you guys could see why their skin issues manifest slightly different. All right, so part 3, the lymphatics, which is kind of in the center of this funnel we're talking about. And this is the one that most everybody knows, so I won't spend too much time talking about it, but it's not just underneath the mandible. There's lymphatics connected to every organ, to every tissue, and it stems all around the body. It's actually quite a fascinating system, how it handles all the extracellular fluid of the body that initially comes from the blood circulation, and that gets circulated back to the lymphatic system along with white cells that are produced in the bone marrow, and handles bacteria and other microorganisms to get filtered back up through the thoracic duct and left and right and get dumped back into circulation so it can be filtered out.
It's they were saying pause like
Yeah.
Andrea, would you be able to put yourself on mute?
Oh, I'm sorry.
It's okay. So back to the complication. So if you guys see the trend, I'm going over each organ, and then I'm trying to point out individual diseases that connect to, I'm sorry, not each organ. I'm going over each part of the drainage pathway and bringing up symptomatology so you guys may be able to connect things that you're seeing in your own pets that may be triggered to part of their drainage pathway. So specific to the lymphatics now, I'll just rattle them off real quick. If you have a backup in your lymphatics, it could be anything from post-nasal drip, this sinus congestion, skin odor. As I said, the skin has a lot of lymphatics, swelling in the abdomen, lower legs and paws, pain and inflammation, the tissue and joints. That's a big area where we don't clear a lot from. Skin and ear, as I said, weight gain. We can have problems with the adipose tissue. And then lastly, facial swelling, puffiness. Those are all signs of backing up in the lymphatics. And then the very top, we're getting organs, tissues, and cells. So this is where I just went ahead and this is more of a reminder, because we do not have the extensive time to go into each individual system beyond the ones I'm covering in the funnel. But any system can produce waste, and any system can have backup. So think about musculoskeletal, someone who exercises a little bit more than their capacity. When they're trying to push themselves, you have lactic acid buildup, and then you have cramps. So each system, digestive system, what you consume, what you break down, respiratory tract, as I said, the carbon dioxide we're releasing, or the stressors from the environment. And I can go down each and every system, from endocrine, hormone, circulation, nervous. Believe it or not, you could have, there's an entire lymphatic system in the brain. When you hear the term brain fog, that can be connected to it. Sensory organs, your eyes, your nasal passages, and up towards all the different nervations for sensory. And again, back to skin. So each of these areas, if they have lack of drainage, the eyes, for example, we get glaucoma, we get fluid buildup, pressure buildup, because it's not being drained. And what do we need to open up those pathways so we can help drain that, as opposed to just blocking it. Blocking the secretion, which is the Western or medical modality. Let's stop secretion buildup. Well, let's talk about what else we can do to expedite the normalization of the fluid in the eye. But again, I'm starting to go down side paths, but this is more just to show you guys the extent of that every system has a drainage pathway connected to it. So now we'll get to the part that I think is the most helpful, because I know this is just it's a quick science blurb, and I don't expect you guys to memorize all these systems or expect to break down every symptom in your pet. But I just want you guys to start thinking about how things can be connected, so you can discuss them with the doctors that you're working with and ask questions. And even if they're not integrative or holistic, you can really advocate for your pet and have some open discussions that can lead to some information that can be very helpful to you. So I'll just get into the basic 4 categories that I work with when I think about drainage. And I'm sorry, guys, but I'm going to bore you. It's going to be a lot of the same thing you hear me talk about, which is foundational support. It's going to be clean water, species appropriate food, avoid toxins. So it's all fitting in there. I'm going to get a little bit more detailed, but specific to this lecture, the reason why you want a species appropriate diet, when you have excessive carbohydrates, the wrong kind of things to digest, all those things take a toll on the digestive tract, and ultimately you can have those symptomatology that we were discussing, or the symptomatology that we were discussing with the diarrhea, the constipation. So it can be as simple as, even if you're already on the bandwagon and you're feeding a species appropriate diet, like we say, we're fans of fresh, moist food, whether it's frozen, whether it's cooked, whether it's rehydrated. We just think that that's incredibly important. And if you find yourself saying, oh, I'm checking that box off, I'm feeding a species appropriate diet, I got that covered. Well, I want to make sure you guys are looking at the stool. And I've seen cases where my own dog right now, he can only eat a few proteins. He's on rabbit. And so I have to switch between brands because it's not always easy to find rabbit. And I noticed on a certain brand, he's actually constipated on this brand of rabbit versus that brand. So guess what? Even though it's easier to get, brand X of this rabbit food, I won't be buying it for him because I know it's going to stress him out. So it's just an easy way to pay attention, even between the own brands of food that you're feeding your dog. Supporting that microbiome, as Dr. Sue talked in previous lectures, we want to think more than just probiotics. We want to think about the actual bacteria that live in the gut. What's the best way to both feed them, and what's the best way to help promote the right kinds of bacteria in our gut. So right now, if you did attend that lecture, she talked about fecal transplant capsules are available if it's found that your dog has a dysbiosis or an imbalance of the microbiome. I do think some of the best probiotics have Saccharomyces, which are actually probiotic yeast, which really target colon health. So I find that those are some of the more helpful and safer probiotics to use, because sometimes, like we were saying before, more is not always better when it comes to probiotics. And we're finding very species specific bacteria and yeast that are necessary for true bowel health, not just hitting them with every probiotic under the sun. Also thinking about what are we going to feed the microorganisms in the colon. We make sure that there's enough fiber coming through, and you can get that through over-the-counter products. Inulin very easily can be found over the counter. Some easy things that I talk about that I think that, I know I sound like I'm beating a dead horse, and a veterinarian should never use that phrase, beating a dead horse. But I really am an advocate for avoiding pesticides in any manner, whether it's in your lawn, whether it's reducing the amount of topical applications that you give to your pet. If you can skip the winter, only apply as you need over the summer as best you can, according to the product you're using. Or if you're in a situation where you don't have to use pesticides for various reasons, using alternatives. Because believe it or not, pesticides, many of them actually have secondary effects on the bacteria in the gut. We've learned that Roundup, the famous spray that everyone uses to kill the weeds that are growing through their cracks, actually affects bacteria. And they think that we're seeing a link from the Roundup that's in our food to all this IBS we're seeing in people and now in animals. So we have to think of the big picture. It's not just, these cidal products are not just killing the one thing they're intended to kill. They inadvertently often set a chain reaction of things. So this is where I was mentioning early in the lecture, I have one skin case. It's a chronic lick granuloma where the patient has licked a sore open in their ankle. And we figured out every month that dog had its heartworm preventative, it would blow up. And so within a short amount of time of not giving that dog heartworm and skipping several months, it was a dramatic improvement. And so we know for that dog is not going to get heartworm, but we're going to take other precautions to avoid mosquitoes and reduce the risk and educate ourselves on what we can do. So again, as I was saying earlier in the lecture, it's about kind of combing through what is going in your dog, on your dog, and how the symptomatology of your dog changes. And lastly, using antibiotics. I need to make this plug about antibiotics. Everyone says, oh, if I give antibiotics, I'm going to give my probiotics. I just have to give it a different time. It doesn't work like that. When they're both in the system, they're both in the system. It doesn't matter if you give 1 hour, half an hour before or after. It's not going to work. So if you want to use probiotics when there's been antibiotic use, I personally recommend after. If you want to use them during, I only recommend Saccharomyces because we're dealing with the yeast, and the antibiotics are antibacterial, are not going to interfere with the Saccharomyces to the extent that we'd see with the bacterial probiotics. So just keep that in mind. Supporting stomach acids. All too often, I hear people laugh about how their dogs belch and burp, and they think it's cute and it's funny. Like, that's fermenting stomach contents. That's not good. And people think, oh, I just give them a little Pepsid. And I say, well, now you just created the opposite problem. The acid imbalance can actually make it harder to digest the food and break it down. And now you can have undigested food particles that lead to food allergies or a number of other problems. So you really, really, really have to make sure you are paying attention and not just covering symptoms, because each part of the intestinal tract plays a role. It's not just, oh, it's just the stomach. It's just a little belching here and there. You really want to make sure you're feeding the right food so you don't get that belching, or do you need to add some hydrochloride, Zypan? There's a number of things you can do. And then lastly, the obvious, eliminate foods that cause diarrhea or constipation. This could be a whole nother series of lectures, but just again, like I was saying earlier, I want you to pay attention. What foods do you notice that cause your dog to have diarrhea or constipation? Work with your veterinarian to get the right balance so that bowel is working properly and you're getting normal kickable stools, as we call them. So that's the lump on the digestive tract. So the next lump of category I talk about, again, is the liver and bile ducts. So everyone knows about milk thistle to support liver, but I really want to, again, have you guys thinking above and below. So if your pet had to have their gallbladder removed or is having bile issues, you may talk to your veterinarian that handles supplements to add bile salts, to add beet-based products. Those can be tremendously beneficial to the gallbladder. You may want to watch the use of the fats that go in your dog. All too often, we think about the fats that we add to dog food as like a side thing. It really upsets me that, like kibble, for instance, one of the reasons I don't like kibble is because we spray the oil onto the food, but nobody talks about the fact after you've opened that bag and it's oxidized, it's rancid. So maybe the first few meals are fine, but after so many hours of being exposed to oxygen, it's oxygenated. So it's rancid fat. So even if it's the best quality fat that went into that kibble, guess what? It's changed. So this is where the devil's in the details. You want to make sure that not only are you avoiding rancid fats, you want to make sure you're only using healthy fats. I see a lot of different vegetable oils added for different reasons, or treats. I see this a lot in treats, and sometimes they're the biggest culprit for causing digestive stress, and people don't even think twice about it. They're so stuck on, oh, it's made of a whole meat. It doesn't have a lot of ingredients. But then the third and final ingredient, because it's just a treat, is vegetable oil. So a lot of times it's as simple as just stopping some of these rancid fatty treats that people inadvertently give. We just don't know because we're not educated. And then rotating healthy fats. I do love adding fish, krill, or flaxseed to my pets' diets. And I do find that they just need to rotate. And I think it's just the same way the dogs need variety in their diets. They also need variety in the oils, so that we're not always taxing the same enzymes to break down those oils, and/or it's just good because they all are slightly have a different makeup and have different benefits. But I do recommend rotating healthy fats. And then the last couple clusters are, again, the lymphatics. So I thought the lymphatics is a little harder because it's everywhere. So it's a little harder to delineate what's lymphatics, what's the digestive tract, what's vascular. But in essence, when the lymphatics are off, the biggest one is the skin. and or the lymph nodes. So if you're having problems with your dog in any of those categories, this is where both supplements can help and also to some physical modalities can help. So some of my favorite are Spanish black radish, Fencho, and Antranex, and these are all made by Standard Process, the company on the bottom right there. They just do a really good job of making whole food-based products that can help really just cleanse the various areas of the lymphatics, of the bowels, of the glands, and liver. So I encourage you to work with the veterinarian that knows these products a little bit better, or even, you can actually even call up Standard Process, and they have tech support, and they can walk you through some of the things that you're seeing, and they can guide you. Now, there's a limit to what they can guide you, but again, not knowing everyone who's on here or where this will be shared, I just want to make sure that everyone has access to different ways to choose the supplements that I'm recommending. The physical ways are, believe it or not, dry brushing. People, that's a thing. Not only do we dry brush ourselves for lymphatics, but just brushing your dog, your cat. It's more than just a healthy coat. You're actually stimulating the lymphatics. Massaging your pet, it's good for you and them. That physical contact. It's not rocket science. It's, as long as you're not being aggressive with your massaging, as long as you're staying off places that are sore. If you have an older dog that has back issues or hip, so maybe you just avoid those areas and you stick to areas that you know that you're not going to hurt your pet if you actually did get a little aggressive. Hydration, that's kind of what I touched on earlier. Filtered water, filtered water, filtered water. I can't say it enough. I almost don't even care what kind of filtered water, but please never use tap water because of the chlorine, because of the other chemicals that do not get completely filtered out. We're seeing a lot of different things coming through the water runoff now from all sorts of sources, from the Roundup, from regular agricultural processes, and from industry. So please make sure that you're using filtered water only, and that's just going to help, the body, the mammalian body, which is 80% fluid, with all its movement. And then lastly, the obvious one, exercise. Exercise is not only good for the movement of the body, but there are feel-good endorphins that are released during exercise, and that just helps the system, period. And not to mention the bonding you have when you're interacting and exercising your dog or cat. And then last part was kind of hard for me to grasp because it's such a big one that, again, we don't have the time to go over each and every cell that produces metabolic waste and the supplements that can be handled. But this is where using a good integrative or holistic vet can help step in and provide specific products for specific organs. But I mainly put this here, say that this, don't forget, this is both a combination of supporting the individual organs and their drainage pathways. So, if you have an eye supplement, don't forget that you're going to want to also consider doing the sinuses as well, because the eye sits in the sinuses. So for me, if I have an eye case, I give the appropriate eye support, and I might add Antranex because it's well known for helping clear sinuses and for supporting that drainage there. If I have a case where I have, again, let's touch on the liver again, the liver supplements, I'm not just going to give milk thistle or say hepatotrophin. I'm going to try to find out, okay, what could be causing this liver stress? Is it all metabolic cellular waste, or are there other stressors happening here? Do we have excessive pesticide use on the pet or in the pet's environment? Do we have some other trigger, chlorine? Do we have use of, sometimes we find that it's the timing of things. I've had pets where they're having seasonal allergies, they have an ear infection, they get vaccinated, and they get their pesticide dose. It's just too much. I don't care if you're holistic or not, whether you believe in the use of these products or not, it's all just too much all at once. So it's really important for you guys to advocate for your pets and say, okay, he's got an ear infection today. If you want to vaccinate, just know that it may not be as effective because his or her immune system is already occupied with an inflammatory process, or it could ramp that up even more. So please don't ever vaccinate your animals when they have a concurrent infection. Help the lymphatics clear, have your veterinarian help you clear that, and then come back at a different appointment, whether you vaccinate or titer, preferably titer if you can, which is collect a blood sample to see if they have the antibodies, but helping prevent the overwhelm of these systems, and then asking for the appropriate organ support related to the issue that you're trying to help your pet with. And then, like I said, the other avenues, if it's, again, that third tier thing is now it's time to do the heartworm too. Well, if they offer you an injection, maybe you say, hey, can I take the pill? Because I want to do my ear infection first. I'll handle the vaccine or titer second, and then we'll go ahead and do an oral pill, because guess what? You can't take an injection back when you give it. So I'm more of a fan of, if my clients are going to use heartworm, I want them to use the pills. Topicals come second, injectables come last, or none at all for me. So I hope I'm painting a picture. I just want you guys to look at all the avenues that affect your dogs and all the pathways. And that's really what I wanted this lecture to pull together about. And again, like I said at the beginning of the lecture, you guys know me by now. I want you to reduce the toxic load by choosing the best products you can, wiping them down frequently. Everyone's lawn and chem and pesticide happy, so wiping them down because they don't take showers like we do. So these are all ways that you can reduce the toxic load. And then lastly, I'm circling back to that blood work. The blood work can tell you a lot, even if it's just looking at a trend. Even if your dog or cat's blood values are normal, look for the trends. If you see that those kidney values, they're normal, but every year they go up a little bit. So, okay, so can I give him some kidney support? Can I give him, do we have enough proper hydration? Are we having too much stress from the liver affecting the kidneys? So sometimes it's not even about elevations in blood work as much as it is changes. And you guys can be empowered to work with your veterinarian to ask the questions. Do you see these trends? And even if they're not familiar with the products, like I said, there's lots of different ways to be able to figure out what products you need, whether you're talking to Dr. Sue on the phone, whether you're calling standard process, whether you're my client and you have me muscle tested. There's all sorts of different ways. But in short, I just want to thank you guys for listening, and I want to thank Dr. Sue and Yulin for having taught me all about drainage, and the various companies who give me the products to be able to help your pets with. And that's all I gotta say. Thanks, guys.
Thanks, Dr. Liz. I totally appreciate everything you talked us tonight. I think everything you've talked about is applicable to all of our pets. Yeah. And especially, you know, the brushing, I think that's amazing. I mean, lymphatics are super superficial. So like they're just right under the skin.
Yep.
We think they're not super deep. So don't feel bad. I mean, brush. Just go ahead and, you know, just the whole body. And I like going all the way from the head down to the tail, you know, down the legs. And yeah, even if you just do it with your fingers and not a brush.
Right? Right.
Yeah, that's pretty cool.
It's
Yeah.
just good on so many levels.
I know. And just the drainage to me is more like opening windows in a house before you decide to stir up the dust.
Yep.
You know, if you stir up dust and try to detox a body before you open the windows, you're going to get a lot of crap that just doesn't go anywhere. So that creates a lot of other problems that we see.
Actually, I'm
stuck.
so glad you brought that up, and I cannot believe I didn't make a slide about that.
You're so funny.
It's true. That's actually, I think that's one of the reasons holistics can get a bad name, because a doctor can start a supplement and then all of a sudden there was a backup. They released a lot of toxin and they're releasing it through their skin, and they're like, oh, you gave that supplement, he's got a rash now. Like, it's not because he's allergic to the supplement. I mean, it's possible, but most of the time it's because they released something too quick and there was an overflow. So that, I'm so glad you brought that up. Yeah, healing crisis is definitely something as a holistic practitioner you want to avoid, and drainage is a way, opening those windows, opening the doors is a way to avoid that. I'm so glad you mentioned that.
Yeah, and there's a question here from Debbie. She wants to know, can you ever have too much drainage?
Can you ever have, yes, yes. Sometimes, and usually, thankfully, it's usually only a problem with practitioners when we use some very powerful drainage products, sometimes some of the homeopathics, but what I find is the cases I've had the most problems with are cases that were borderline already an organ failure. Like my biggest ones are kidney failure patients that were borderline, but they were stable. They didn't have obvious disease, but like I was saying, those levels are right there. And a practitioner started a homeopathic supplement for the liver, and the liver released, and the kidney's like, I can't handle this. This is all I got. And it sent them into failure. So it is important when you're starting products that are very specific. The general products, not so much, but it's ones that are very targeted for individual organs that you better make sure those downstream organs and drainage pathways are open, because you can push either aging pets or pets that were on the brink into a complete brink. And that's like a severe healing crisis that sometimes you don't get them back from. And I've seen it happen a couple times. Thankfully, only twice, and neither of them were my cases, but it's heartbreaking when it happens. But I don't want you guys who are watching to worry about that, because again, that's more when a practitioner uses a very specific spot on product in a certain way that just sometimes it happens, and I'm sure it'll happen to me one day. But
That's great. Does anyone have any other questions? I'm looking at the chat right now. I don't see much more coming through. I appreciate everyone's time tonight. If we don't have much more to say, Liz, then we'll probably sign off. But we want to also let everyone know that we're highly considering doing a muscle testing workshop and a seminar for about, what, 3 to 4 hour period of time. Is that about right? Yeah. So you'll be getting an email with a survey to see if you're interested, and we're pretty excited about it because we'll be teaching you in person all sorts of things about the history of muscle testing and energy medicine. And Liz, you're the one that's giving all of the talks pretty much, but we'll be kind of introducing you to pendulum work and testing your own pets for, you know, simple solutions to immediate issues. Is that right? Would that be appropriate?
yeah. It's a work in progress, so it depends on what people are asking for, but I think starting at the basis is good.
Yeah. So that's our next project. Thank you all. Thanks for your time tonight, and we'll look forward to seeing you and your pets, and give them all big hugs and kisses for us.
Thanks,
Thank
guys.
you.
Good night.
Good night.